Next slide. And with this, I'm going to hand it over to Kevin Stevenson, who's going to talk about behavior, building positive behaviors. Kevin?
Great. Thanks, Amy. So, yeah, today we get to learn more about building positive behaviors, really encouraging strategies to encourage kids to do things that'll be good for them, independent skills, and teaching those positive behaviors that we want to see more of. Let's go on to the next slide. And so the learning today, we're focused on two main points, two main objectives. The first part of it will be building positive behaviors. We'll talk about things, how to increase kids' motivation to do things through using incentives, reward programs, catching kids being good, using deliberate playtime. And then the second part will be talking about strategies to help kids practice following instructions. And that can be the art of us giving more effective instructions, and then how to actually practice the skill of following instructions when it would be good for them to. Let's go to the next slide. So a few points before we get started. First, the words we use matter. And so, we, with input from those in the autism community, we try to be really intentional about the words that we use. And so sometimes if we, use words like we should do some planned ignoring of behavior. Instead of ignoring, which might have a negative connotation, we might instead frame it as intentional attending. We want to make sure we're paying attention to the things we want to see more. Instead of prevention, we might think of proactivity. Look for the underlying need that the child has, and how do we understand that and address that, and accommodate for that when it's necessary and when we can. Instead of compliance, training of, kids must follow, we think about resilience, teaching kids to how to make good choices and good decisions, and how to help them be more independent. And another one, oftentimes we might talk about problem behavior, challenging behaviors, instead thinking maybe on a more neutral side of something that's interfering behavior, that's interfering with their independence, something that's interfering with family life. And the focus here will be on meeting the needs of the children, and not necessarily say this is a good or a bad behavior, but just trying to remove those barriers to get kids in a positive space, again, increasing their independence and decreasing any of that interference with the family environment. Next slide. So there are many types of behavior programs. Some of you might have heard of different ones. Oftentimes there's an acronym with it: PBS, PRT, DTT. And so some of it is, the positive behavioral and support programs works to, changing more in the environment, teaching skills. Pivotal response training is, as the name implies, focusing on a few pivotal skills like motivation, communication skills. Ruby parent training, which is the basis of a lot of the strategies that we're going to be talking about today, is a more general program of teaching caregivers skills that can help improve behaviors. And then there's also discrete trial training, which is working one-on-one with kids to teach the skills in a controlled step-by-step way. And so ABA oftentimes falls more within like the PRT, DTT areas, where the focus is on, the child-directed intervention with the child, whereas things like Ruby parent training, that is more focused on, let's teach the caregivers and those around the child skills so that they can incorporate all those good principles all the time, rather than just having a certain time of the day where they can get those directly from a therapist. Next slide. So One of the terms that we often use when we talk about these behavior strategies is reinforcement. And that might mean different things to different people. As behaviorists, when we talk about reinforcement, we are thinking of something as a reward or something positive that makes people more likely to do things in the future. And once we actually understand this idea of reinforcement from that basic level, we start to see that reinforcement is all around us, whether we're being deliberate about it or not. When good things happen, we tend to repeat those things and do things that make good things happen. It's just kind of in our nature as human beings. And so, one way I like to think about this idea of reinforcement is this idea of we're trying to boost motivation. Uh, we're using rewards, but really, if we think about sometimes, doing these independent living skills or whatever behavior that we want to see kids doing more of, one reason why it's not happening as much is possibly that just the motivation to do it is not there. It's not just a will issue, but it's how can we structure things to make that barrier to do those behaviors more feasible. And so, like I mentioned before, we all need and we all use reinforcement in relationships, in our work. I love what I do in my profession. If I didn't get paid to do it, I probably don't love it enough to keep going and doing it. And same thing with relationships. Hopefully, when we're doing when we're in a relationship, there's some positive aspect that we get from it. And so, again, understanding this principle that this is just part of our human existence, that reinforcement happens. And so when we think about reinforcement as a more of a deliberate strategy to use with kids, I think sometimes a common worry for caregivers is that, oh no, if I use a reward system to increase behavior, then like I'll always have to use that for the rest of the child's life. And something we make sure we want to help people understand is that rewards can be phased out, and the frequency of rewards can be phased out over time. And it's something that can help again from the initial motivation side. Let's build up the momentum of kids learning to do something that maybe they haven't been as successful with before, and use those motivation boosters, those rewards to get things going. And then as they can build up that new skill, that new habit, then gradually over time we can start to pull back on some of the reinforcement, and maybe there's other things that keep those positive behaviors happening. Next slide. And so, oftentimes we might not appreciate how many different types of reinforcers there might be. And one way to kind of broaden our understanding of what a reinforcer is to think about different types. One type is called primary reinforcers. So these are things that are like food or drink. Sometimes for me, I tell myself, okay, work on this paper for an hour, do my chores, and then I'm gonna reward myself with uh, a chocolate bar or something. So even for me, just knowing that like, oh, there's something to look forward to, uh, can be reinforcing for me, can help increase my motivation. I think when we use primary reinforcers with kids, we need to be careful, right? We want to make sure there's an increase in obesity rates in kids, and there's a lot of attention on diet and healthy diets right now, and so primary reinforcers like food or drink probably shouldn't be our primary source of reinforcement, but there might be times when that could be a great type of reinforcer to integrate for any particular behavior. Another type of reinforcer is a social reinforcer. So this might any sort of social attention, high fives, hugs, even verbal praise, saying great job. And so for some kids, this works super well. I think the one really important thing to think about for this, particularly if we're thinking about kids on the autism spectrum, is that something that seems rewarding for us, particularly with the social side of a high five or a hug, it may be even the opposite for, the kid we're interacting with. And so when we are thinking about social reinforcement, we want to really make sure that we are reading the signs of the child to see what are they enjoying. Do they enjoy it? If not, can we change the type of social reinforcer or reaction that we give? Because we, in the end of the day, it should be a positive thing for the kids. If it's not positive, it's not a reinforcer. It doesn't matter how many other people think that it's a reinforcer for the child in front of us, if the thing that we're doing is not positive to them, it's not a reinforcer. A third type of reinforcers are tangible reinforcers. So these could be, toys, Pokemon cards, enjoyable activities, just any sort of tangible thing that they get to do. And this is, can be a great type of reinforcer. Another related one is activities or privileges, screen time, a trip to the park, going for a walk. Those sorts of things can be another broad category of reinforcers that we could consider as we think of what might we use to build up kids' motivation. And then the last area is a token reinforcement. So has no value in and of itself, but can be used to purchase other reinforcers. So a token system or a sticker chart, even money can be thought of as a token reinforcement system. And this is something that works for some kids and not for others, tends to work better for older kids. And I saw a question come through in the chat of, are reinforcers bribes? That's a great question, and we get asked that all the time. And again, if we kind of relate it to our everyday experience, are we bribed to go to work? Maybe, maybe not. I think a large part of bribe, if Barb Mackinac-Coons, who's one of our hub members, was here, she oftentimes mentions that a bribe is typically for something illegal. We're not doing, hopefully we're not encouraging our kids to do illegal things here. So one of it is, what's the content of the action that we're getting. So that's the thing for a bribe. And then I think another important aspect with this idea of are we bribing is, when are we bringing in the reinforcement? Ideally, we should be saying, here's the expectation, and out front, here's the reward for it. If you do your homework, then you can have 10 minutes, an extra 10 minutes of screen time. I think sometimes where it gets tricky is we tell kids, do your homework, and they're like, no, I don't want to do it. And then we say, well, if you do your homework, then you can have screen time. So there's this kind of negotiation that happens. And then we're getting kind of more into, again, not bribing, but it's less effective use of reinforcement, that we want to make it clear from the beginning, here's the expectation, and then here's the reinforcement that can come from it. And so having it clearly set out from the beginning, having a visual reminder of things for reinforcement, that can be an effective strategy to really clearly communicate that with kids. Let's go on to the next slide. And so again, reinforcement is a behavioral term that involves anything that happens after behavior that increases the chance of a behavior occurring. If it doesn't increase the chance of it happening again, then it's not a reinforcement. It's not actually reinforcing. And so oftentimes when we think about reinforcement, another thing we commonly hear from caregivers, families, is reinforcement doesn't work for my kid, or it doesn't work in autism. And I think that is definitely a valid concern and valid experience that many people have. I think that one of the tricky things about reinforcement in general is that oftentimes we have to think creatively. The things that, again, may appear like they should be reinforcing for many kids, or things that often are reinforcing to many kids, may not be reinforcing to many autistic children. And even more relevantly, it may not be reinforcing for, again, the child who is in front of us right now. We really need to make sure that we are thinking of this individual approach, of the child in front of us. What is reinforcing to them? Another tricky thing is that it can change over time for a kid. Something that's reinforcing for a kid today may not be tomorrow, and so we have to always be think creatively and uh, iterating on our process to keep seeking for that thing that is that's reinforcing. As I mentioned before, offering the reinforcement with the initial requests instead of after it is really key. And then the
Kevin,
other key,
Kevin, can I
yeah,
interrupt you for just a moment? Because Eric asked a really nice question that I thought this is a good spot for. She was Erica was asking, how important is it for reinforcements to remain consistent across locations? So, say home or school, for example.
yeah, that is a really, really great question. I think the general principle is the more consistency, the better. I think where it can be difficult is when that's not always possible, right?
Mm-hmm.
Sometimes there could be um, types of reinforcers that are easily given at home, but they're not able to be given at school, right? So there might be some activities that kids can't do at school, but they can do at home, like tablet time or things like that. And so I think what I would what I would say, and I'm curious to hear from our other hub team members too, maybe again with this overarching principle of consistency, and maybe I would come up with a plan that's really consistent plan of what reinforcement looks like at home versus what different types of reinforcement happens at school, and make sure that everyone at school, everyone at home is on the same page with that plan. Chaz,
Yeah,
others, what thoughts do
yeah,
you
Kevin,
have?
I'm right with you on that. I agree, and I think another way to think of it too is another way to think of reinforcement's going to be better if it's consistent. It's going to be quicker. So the more you reinforce something and the more context you do it, the more quickly it's going to go. That doesn't mean that if it can't be in every context for all the reasons Kevin said, doesn't mean that it's not going to have any reinforcing value. It just may not be as quick to pick up as something that's being reinforced every time. But as you can all think, there are going to be times where you also need to learn that things can be reinforced here, but it may not be there. There's different, we call discriminating circumstances that it's important to learn over time. So this is where it's helpful among teams to have a plan across different settings when we can and communicate as best we can. That can be tricky sometimes. Thanks, Kevin.
Yeah, thanks, Chaz. And I just want to give a highlight to what Sarah put in the chat that yes, we definitely have to be very specific about what we're expecting. Going to this last point of the balance, the behavior, the expectation has to be feasible, and the reinforcement has to be large enough and motivating. And so having more specificity in the behavior, the request, can make it more feasible. And then we want to make sure that we find that balance between the how motivating that actual reinforcement is. Okay, let's go on to the next slide. So this is a pretty busy slide. You don't have to memorize this right now, but these are general principles of how to set up how to set up a reinforcement plan. First, you want to select that target behavior. Like Sarah said, be very specific in what we're thinking about. Make sure it's a reasonable thing. It should push them a little bit, but it shouldn't be well beyond what we're seeing them do consistently. And then we might want to decide how often are we going to reinforce that behavior? Is it every time they request something? Is it every time they go clean their room immediately after we say it? Or is it after every third time, every half the time? That can be a decision. We want to make sure the step 4 is giving the reinforcement as close as possible to when the actual target behavior happens, so that we really pair that the idea that the reward is for exactly what we're hoping that they do. And then we want to base the reward on the actual outcome or effort. Sometimes, oftentimes they're not going to be perfect in it, but if we see them putting an effort and getting close to it, that can be an appropriate time to reinforce that, because that's what we want to see more of. We don't expect them to be perfect, but we expect them to put forth some effort there and make a step towards that progress. Step 6 here is the idea of how to maintain the value of the reinforcer. I oftentimes talk about, Bill Gates. If you give him a $5 bill, that's not going to be very reinforcing to him, because he has millions of $5 bills, and the same principle can apply for a kid. If they have unlimited access to their tablet throughout the day, an extra 10 minutes isn't going to really be valuable to them. But if we restrict tablet access, for example, then the value of time on the tablet will be that much stronger for them. And step 7, we talked about the different types of reinforcers. We generally recommend to combine any type of reinforcer with some sort of social reinforcer when appropriate. Again, when appropriate for the child, for the type of social reinforcer, but we want to build on those social aspects that can be maintained even after we remove some of the more artificial reinforcers along the way. And I mentioned the step 8 before. Visual reminders can be really, really helpful as we set up this plan to make sure that everyone's on the same page. Next slide. So this next section is what we like to call catching your child being good. And what this entails is kind of using our attention, our focus, to encourage more of those behaviors that we want to see again and again. That might be using manners, playing nicely, doing some sort of skill independently, cleaning up toys without being asked. And one reason why this is important for us to think about more deliberately is, unfortunately, oftentimes it's easy to miss those good things that happen all the time. And we need to be more deliberate about recognizing those and making it a teaching moment, a good deal, that we want to keep those happening. When we focus on things, when we pay attention to things, those are also things that tend to happen more often. And so for this, write down those behaviors that you want to see more of. It could be any of the behaviors that we have listed here or other behaviors. Just think about what do you want to see your child doing more of. Write those things down, and then make notes of watching for those moments throughout the day. Chances are they're actually happening more than we might realize. And so it can be good for us to realize for the child, because then they're doing it more often. And it can be good for us, because then we can recognize all the great work that kids are doing. Next slide. Playtime is a really important thing, really valuable thing for kids. They really need this one-on-one structured playtime with us as caregivers. It can be great opportunities to help develop play skills, learn social skills that we need for life, like sharing, taking turns, some cooperative play. It can be also good for building language skills. And I think maybe even more importantly, it helps strengthen the relationship between the child and the caregiver. We can use it to reinforce more appropriate behaviors. We can use it for those chances to catch kids being good. And so what this entails is really having deliberate time with a caregiver and the child. And so oftentimes you have to plan ahead, setting aside a time. We're gonna schedule 15 minutes to be together, me and Johnny. We can decide on activities to do during that. Generally, we want to have these be child-led activities where they get to decide what to do, and we try to keep our direction pretty minimal, where we're doing a lot of repeating what they do, shadowing, playing along with them. They get to call the shots, where it's this really nice, low stress, hopefully, time to spend time together. Next slide. So some other guidelines for this structure one-on-one play: start small. It can be 5 minutes at a time. It could be 10 minutes. It doesn't have to be big. It can grow there. As I mentioned before, there's a lot of observing, a lot of letting the child lead the activity, imitating what they're doing, even being like a sports announcer and describing what they're doing. Oh, you're putting the blocks together. That's lots of fun. You can reflect what they're saying and maybe add to it. If they say, look, block, and you're like, that's great. Yes, you found the red block. You can promote additional skills. You can, again, praise those behaviors that they're doing, or pay attention to those and recognize those. You can model some types of play without being overly directive. And like I've been saying several times, make sure that the praise is adapted for the individual child. And then during this, structured play, we want to avoid commands, avoid directing the play, and have it be, again, more of this child-led special time. Yep, and I think that's all I have for that one. So let's go on to the next slide. Some additional troubleshooting and helpful hints for this. You can brainstorm the different times for the play. Just maybe if there's a time where maybe another caregiver is at home to watch other kids, or a time before other kids come home, or is there a neighbor that could come watch some of the other kids, or could someone else help with getting dinner ready so that you can have that one-on-one time? Those sorts of things are really helpful to think about. It can be good to avoid toys or different activities that have a lot of structure or rules, particularly if you don't want those rules to be broken, right? So if you're fine with whatever goes during Uno, then sure, play Uno. But if things require a lot of structure, maybe think of some different activities instead. It can be best to avoid any roughhousing, any messy activities. Finger painting may not be the best thing for, again, this particular special playtime. It can be good to prioritize more interactive toys as possible, like construction toys, play sets, creative toys, things there. Next slide. Okay, so we talked about incentives, rewards, and things like that. Next, we're going to talk about helping kids get good at following instructions. This is an important skill for kids to develop, sometimes to keep them safe. When we say, stay out of the road, come here, those are really important for their literal safety. There's other things that, in our society, there are times when we have to follow instructions, we have to follow rules. A challenge for this, though, is oftentimes kids get a lot of practice not following instructions, or they hear us say something and we repeat ourselves multiple times, and so more often they are not listening when we say something than when they actually listen. So where to start for this? If you want to say, okay, let's come up with a plan to get better at following instructions, start off by creating two lists. One list is typical instructions that that they do follow consistently. Maybe that's like, eat this candy bar. Maybe a lot of kids would follow that pretty readily. So most likely there's at least some of those instructions, commands, things that they do consistently, and then come up with a list of the things that they don't do consistently that maybe you want them to do. And so that's a great place to start, and we'll talk in the next few slides about what to do with those. Next slide. So we're going to watch a scenario here and think to yourself, does this sound familiar at all?
Boys, come on! Let's go! It's time for bed! Guys! Come on, it's getting late! Boys, come on, let's go! It's time for bed!
So even though it doesn't seem like it here, the kids are practicing something. Mom was saying multiple times, kids, come on, let's go. It's, time for bed. At least 5 times, maybe 10 times. And every time they heard that and didn't do anything, they were practicing not following that instruction. So let's go on to the next slide. And we talked briefly before about effective instructions, being very specific about things. So some principles that can help the way we phrase things. One is phrasing things as a statement rather as a question. And so time to go inside versus are you ready to go inside? Kids, when they are given an instruction, or if we say to them, are you ready to go inside? They might interpret that as a literal question of, no, I'm not ready to go inside. And so even just phrasing things as that statement, we can be polite, we can be pleasant and everything. We don't have to have this harsh command, but saying it as it's time to go inside, sometimes that little shift can bring big dividends. And then keeping things really specific versus broad. So put your toys in the bin versus time to clean up. We want to be very specific as we can be about what we want them to do. One thing that we saw that might be hard from the video example that we just watched is we may not have kids' attention. Mom was upstairs, kids were playing on their devices, and so they're not set up for success there. And so removing distractions, getting eye contact or being really close to the kids when we're giving the instruction, turning off TVs, having them put down their devices, can really be impactful to make sure that they're actually paying attention to what we're trying to get them to do. And then keeping it simple. This goes into the specificity recommendation is let's start with one thing at a time rather than put your toys in the bin, get your clothes together and come upstairs. Do one thing, have them follow it, do the next thing and have them follow it. Breaking things down can really set you up for success. Next slide. So this is a slide that gets at this idea that I've been repeating, whether it's in sports or in music. Sometimes we have, in society, we have the phrase practice makes perfect. I was a musician, did music growing up. I had one band leader, band director that said that's actually not true. Practice doesn't make perfect. Practice makes permanent. And that was really impactful for me, not just for music, but in other things that I do. Sometimes we think, okay, I'm practicing something, I'm working on this, so that means I must be getting better. But if we're practicing the wrong thing, or if we're not practicing effectively, then we're not getting perfect. We're just making things become more permanent. Luckily for behaviors aren't actually permanent. Whatever we learn, we can unlearn or relearn or learn something else entirely. And so that's the positive aspect to all of this is we can be deliberate about doing things. And so think about that as as you give instructions, as you do things, even keeping a tally of how often are the kids following an instruction versus how often are they not. And let's try to shift that balance so they get more reps, more practice following instructions versus not. Next slide. So additional steps steps that can be helpful. This idea of practice following instructions, it tends to work better for younger kids or kids that don't have as much language ability. As kids get older, you talk more about consent, and they don't have to follow every instruction. For younger kids, that's a harder concept to understand. So it's the first building block is just getting good at following instructions. And so, with younger kids, maybe the goal is to practice following instructions the first time without needing to repeat. So we might want to start with an instruction that's really easy for them. Take this block, eat the candy bar, anything that really gets this practice of we say something, they do it, and that's the process. And then gradually we can build on that to have something a little bit trickier. We can use our reinforcers to really help this be a habit. But again, we want to practice this of give instruction, kid follows instruction. Some helpful tips with this. Like I said, start with something that they're already doing, gradually change it, gradually increase it over time. As a reminder, musicians, they don't start learning concertos. They start learning simple Twinkle, Twinkle, Little Star. Same thing with sports. They're not doing these complex, plays. Start with the basics and gradually move up there. Next slide. So here's some steps when you start come up with this instruction practice session. Stand close to the child, get their attention, tell the child instead of asking what to do, say it one time, and then at the same time physically guide the child over time if needed to make sure that they're following through with this. That physical guidance, it depends on the child. If kids are really averse to any sort of physical contact, then obviously we wouldn't use that. Some kids, it could just be like light touching of their elbow to kind of get them moving, or touch on their shoulder. Just that prompt to help build up that momentum of them following through with that. And then as they do it, be providing this immediate specific praise, comments, feedback on this is a great job, keep it up. And then as we work with that, we can start to increase the physical distance from the child over time. We can fade out that physical guidance. But again, we want to set up this pattern of following instruction the first time rather than needing to repeat ourselves several times. Next slide. A few things on this idea of the idea of no or stop. I imagine many of us have reactions, or could see kids have very strong reactions with any sort of no. And so sometimes if we can avoid saying no or saying stop, it's even better. So instead of saying stop doing that, let's tell them something to do instead. And so instead of saying stop running away, we can say come here, or let's play with these toys. And again, having that positive yes instead of the no can set us up for success. Next slide. And then
Hey,
there's
Kevin, I'm
Will
here.
here.
Yep.
I'll hand things over to Will.
So, hey, everybody, I'm Will Lever. I'm a pediatric psychologist at Nationwide Children's. Appreciate everything that Kevin has been talking about. And one of the things we want to bring to this talk is that oftentimes these skills are delivered by specialists in big hospitals, like where we work. However, we know there's a bunch of barriers to care for you all out there. So we've got these really complex treatment protocols. There's still a lot of stigma. And then there's just a lack of specialists. Oftentimes there's areas where there aren't any specialists for miles around. So in order to address this and deliver the skills that Kevin has been talking about, we have a couple of solutions. So if you can go to the next slide. What we're trying to work on is to simplify treatments, make them a little bit easier for families to implement. We are on the verge of using digital technology a lot with patients. It's still a bit the Wild West with that. And then we're trying to share the work. Part of ECHO is everybody teach, everybody learn. And so we want you guys to be able to use some of these skills right away and at home to really help. So I hope the volume is okay. I saw the note there. Um, Go to the next slide and we'll talk about a couple of options that we have. So one of the first options is a paid app called Attend Behavior. This was, just for clarity's sake, it was developed at part at Nationwide Children's, and it really goes through all of these skills in really great depth. One of the things that it's really helpful for is reinforcement and all the other skills we've been talking about. The downside is there is a cost associated with it. Some other free options that are out there, well, actually not necessarily free, but often options that people have access to are the virtual voice assistants. So what you can use like Alexa or Google Home or some of these other options is you can schedule routines. You can give reminders. You can have them practice social stories or social skills. And it's a great way for, I don't know if we have any examples tonight, but oftentimes when we talk to parents, they'll use these resources to really help with the skills we're talking about today. We are on the verge of a lot of help with AI, artificial intelligence. There's actually research out there that suggests apps like ChatGPT can be used fairly reliably to give instructions on intervention and recommendations. You have to be careful with these, though, because there are what are called hallucinations. They'll give false information. Most of the time, they're very accurate, but there's still a lot of work left to be done. So don't use those without caution. Another interesting area that's been developing is what's called single session interventions. A study came out not too long ago where they looked at kids with autism who also had anxiety, and they gave them these free online interventions. They worked through them with their family, and they found it didn't necessarily lower the anxiety, but it did help kids feel like they had more control over it. We also have an association with the Kids Mental Health Foundation, which has a lot of wonderful free resources that they deliver across the nation. And then there's always more things out there that I do not know about. So feel free to chat in your favorite app. I always recommend being cautious when trying something out and make sure to look for the evidence supporting it. There's a lot of great resources out there. So hopefully in the future, we'll have even better recs for you all, but this is a place to start. Thank you.
So here are some resources that are available. The Ruby Parent Training Program, there are lots of resources there, including free handouts or worksheets to do some of the things we've been talking about. Will mentioned the Attend Behavior. Those in the state of Ohio can talk to County Board of Developmental Disability workers to learn more about getting access to that within Ohio. Autism Speaks has a lot of really great toolkits. The one here, the Challenging Behaviors Toolkit, is also one of the great ones. Autism Speaks has other resources there, and let's go to the next slide. And then more resources here that will be available to you after the session today. Next slide.
Yeah, so now's a great time. You know, we've had a few questions come through in the chat, but now's a great time. If any of you all have questions about any of the stuff we were talking about today, either for Kevin or myself or Well or Sabrina or Amy, feel free to join in the chat. Also, feel free if you wanted to unmute and give a question here. It's a good time for anyone who may have them. So I'll pause here in case anyone has any questions for now.
Chaz, there was a comment from Erica in the chat about understanding more about how Alexa can assist with routine.
Oh, thank you. I missed that one.
Yeah. Any thoughts? I think it's cool. You can set timers for different things and you can just have it kind of go off and say, you know, Alexa set a timer for, 5 o'clock to get ready for dinner or something like that. So, and then it'll just kind of set it off that way.
It's often good for the parent to set it up for the kids, but then it has a kind of a secondary effect of almost sounding very authoritative to have that voice coming from someone else. like, oh, it's time for to brush teeth or get to bed. Um, Also, and as Karen mentioned, you can also have the child use the Alexa to set the timer. It can be an interactive experience. And another thing you can do is throw in instructions and ChatGPT on how can Alexa help me with using this. How can ChatGPT help me with Alexa to support routines? So you can kind of start to use the tools together to benefit.
Excellent. Thank you, Will. And we had a question, well, for Kevin first, and we'll let others chime in as well, about why some children may be still having some aggressive behaviors or maybe seem to be doing better with treatment for a while, but then seem to have a spike in aggressive behaviors. Any thoughts about that, Kevin?
Yeah, I think there could be lots of reasons for that. A new situation. Sometimes kids just have this, normal reaction where things are going well, and then it can, come again. It's not necessarily a sign that things are wrong, but oftentimes it can even be a sign that things are working well. I think it could be a good reminder to come back to return to the principles and consider what might work well, and maybe change some of the reinforcement strategies, make some tweaks along the way. Jazz or others, what else?
Yeah, no, I think I like everything you're saying, Kevin. And I would just add to that in thinking this is why when we're doing either behavior therapies or when you're learning about some of these behavior strategies, you know, people are moving targets. They respond differently on different days at different times. And while there's always trends, this is why there isn't like a simple if A happens, then do B and it'll fix the problem, because things change on a day-to-day basis. And that's why we want to be thinking about different tools and different settings for problem solving to help us think through what may be happening each time or each day. And so let me give you another question here, Kevin, before we run out of our time. But you're asking a little more about if you could elaborate a little more on how we could use visual schedules or visual cues to help with reinforcement. Any thoughts
Yeah,
on that?
Erica, that's a great question. I think this can look really different. For some, it might be a whiteboard, and you can write down the expectation on the whiteboard. You could have a place to check it. For other kids, you might have actual pictures for things, and you just have taped to the wall or somewhere where you can have the picture for the behavior that you want to see, and then a picture of the reinforcement. For others, it could be on their app, an app on the phone where they see a picture, or a lock screen where they can see what happens there. Um, those are some ideas to get started about thinking of whatever, just some sort of visual cue that the expectation, do this, then this happens.
Yeah, thanks, Kevin. And I think this is another good time to remind everyone. Our hope with this is that these are giving you guys some ideas, some thoughts. It's not going to be the whole thought, but it's going to be a start of a thought. Maybe that's something we can take to school, to take to some of our therapists, to take to some of our doctors, and see if they can help you kind of implement or think about how to use those things in other settings. So I think if Sabrina